Thank you. It's good to be here. It's always a pleasure to have the opportunity to talk to couples, women, and whoever is interested about issues related to pregnancy and fertility. My name is Aigbe Gregory Ohihoin. I am a consultant obstetrician gynecologist and the Deputy Director of Research at the Nigerian Institute of Medical Research and consultant and director at the HICI Healthcare Limited. So I will be happy to take your questions and talk to you about this issue, topic before us.
All right, thank you very much, Doctor. All right, so to the very first questions, I'm seeing that some persons are already dropping in their questions. Don't worry, we are going to be treating it immediately after this section. But to the very first question we have today is, when and how can one determine the sex of the baby?
Okay, great question, Lucy.
When and how?
Okay, when and how. Okay, great. Now I'll take it from two perspectives. I believe that the one that will interest a lot of us is how to predict the sex of a baby before conception. Because for those who are already pregnant, it's pretty much easy to determine the sex of the baby. There are ways to do that. So I'm going to look at it from that perspective. So I'll start by dismissing the easier one, which many of us are already used to. So if someone is already pregnant and wants to determine the sex, of course the most reliable way to do that is to have an ultrasound performed, which is pretty much available in many places that you go to, antenatal clinics and even diagnostic centers. And you can do that as early as before 14 weeks, depending on two factors. One, the skill of the sonologist and the resolution of the machine. By that I mean the ultrasound machine, how effective the machine is, and also the skill of the person who is performing the ultrasound. So before 14 weeks of gestation, which in other words, we are looking at about 3 months, what you may call 3 months in the lay parlance, what we call 14 weeks, you can determine the sex to a reliable extent in pregnancy. Now, as the pregnancy becomes bigger, between 14 to maybe 24 weeks, you realize that because the quantity of fluid, what we call the amniotic fluid around the baby, is too much, ultrasound requires good quantity of amniotic fluid around the baby to get very good views. So between that 14 to 26, 28 weeks, you'll still be able to see very clearly. But as baby becomes bigger in the third trimester, it becomes a bit more difficult to determine clearly the sex using ultrasound. That's with ultrasonography. But most sonologists will be able to determine to a good level of certainty the sex of the baby. Then I want to talk a little bit about other methods after pregnancy has commenced. Very early in pregnancy, say before 8 weeks, very early, at 5, 6 weeks, there's a newer method where you can take the sample of the blood of the woman who is pregnant and test for what we call cell-free fetal DNA. In other words, you're actually testing for minute quantities of the baby's molecules inside the mother's blood, because